Okay, did you translate the question?
Because it looks like it's a repeat of some of the things that we already said.
Okay, I'm very sorry. I think that okay, I will explain in English. It's a patient that felt that his son, he's presenting Stephen Jones syndrome, and he used a kind of medicine that is called phenytoin.
Yeah, Phenytoin. Yeah, that's,
Okay.
yeah. Uh-huh.
So the neurologist is thinking about what kind of medicine he can change in this case specifically. Okay, what's the best medicine to change this phenytoin?
Yeah. So as I mentioned earlier when we were discussing this, I said either the 10 or the SJS Steven Jensen syndrome may be due to dilantin, which is a phenytoin, and carbamazepine, which is a Tegretol, and also some antibiotics. Even it could be any medication that is the patient is getting that is causing these things. So if this young patient has uh, seizures and needs the phenytoin to survive, and that is causing a problem for him.